In Latin America, the most recent evidence shows that prevalence rate of dementia is highest among most countries. And we are now aware that there is an issue that calls attention to low and middle income countries as well. That is why, following WHO's advice, the regional office, the Pan American Health Organization, has developed a specific action plan. We have been working on the development of this action plan since 3 years ago, and finally it was issued in the September session, and it was signed by all the health ministers in the region. This is a significant step forward because it is helping us raise awareness. Now that all the health systems in the region are aware of this situation, we can keep moving forward in order to develop specific actions during the next 5 years. Dementia comprises need for care. As we do not have a cure nowadays, we are mainly concerned for care of people afflicted with these disorders and support for their caregivers, because the illness doesn't only affect those who suffer it, but their immediate environment. And we are committed with helping the region move into the development of a formal long-term care system, which is urgently needed for this and other purposes of disabilities related with non-communicable disorders as well. Latin America tends to be considered homogeneous, but in fact our countries differ significantly. We have high-income countries, or almost, such as Chile, and we have very, very low-income countries such as Haiti in the Caribbean. So there is a very wide difference in economic development, and there is a wide difference as well in cultural background. It's difficult to talk about Latin America as a unit. For a Latin American can be a Jew of European origin, or an Aboriginal of American origin. So it's very, very varied. And the prevalence of risk factors varies very widely also around the region. For example, diabetes and obesity are seen particularly in Mexico. But in countries like Chile, obesity isn't really a concern. So the public health approach towards prevention and control of risk factors varies significantly. The action plan, as I said before, is now helping us raising awareness about an issue that should be of concern for all local governments. Now we must help onto the development of specific actions at the local level, and we have to enforce this somehow. The first step is to develop a set of indicators that should be reported by the different governments. Once this happens, we will be able to establish comparison within different countries and the actions being developed, and it always helps to move things forward, because the development of specific actions at the local level will be very expensive, and we are competing with many other priorities in a region that is still afflicted by the pathology of poverty in many cases, and by other significant pathologies such as diabetes and cardiovascular disease. But in fact, we must realize that there is a convergence of risk factors, and if we address risk factors for diabetes and cardiovascular disease, we will be protecting brain health as well. And we want to to make sure that the health ministries are aware of this and that the actions towards healthy brain aging will help us move forward into the prevention of cardiovascular and metabolic disease as well.